In this book, Dr. Makoto Mihara and Dr. Hisako Hara, specialists in lymphedema treatment, clearly and concisely explain practical lymphatic vessel ultrasound techniques. The book is designed for ultrasound technicians who perform lower limb venous ultrasound tests on a daily basis, as well as plastic surgeons and therapists involved in lymphedema treatment. It covers a wealth of insights, with various 3D animation images and clinical cases, providing extensive knowledge, immediately useful in clinical practice. We strongly encourage reading this book. Additionally, to complement this book, we have created 11 videos that thoroughly explain lymphatic ultrasonography. Here, we introduce a selection of these videos. Lymphatic vessels are found in every part of the body. They collect interstitial fluid, containing waste products from tissues throughout the body, and carry them to the heart as lymph fluid. When the lymphatic flow is compromised, lymph accumulates in the tissues, causing lymphedema. The collecting lymphatic vessels in normal limbs are translucent and have a diameter of about 0.2 mm, referred to as the normal type. The lymphatic vessels degenerate when lymph fluid stagnates after a procedure, such as lymph node dissection. First, the lymphatic vessels dilate, referred to as ectasis type, due to increased internal pressure. If the high inner pressure continues, the smooth muscle layer of the lymphatic vessel wall will eventually thicken, causing the inner lumen to shrink, referred to as contraction type. Damage to the lymphatic endothelial cells causes lymph fluid to leak into the surrounding tissues, resulting in lymphedema. Ultimately, the lymphatic vessel wall becomes significantly thickened and sclerosed, referred to as sclerosis type. The course of lymphatic degeneration described is called the next classification, named using the first letter of each type. A normal lymphatic vessel appears as a hypoechoic black lumen that is slightly visible between hyperechoic white double lines, which is referred to as the equal or hamburger sign. In the ectasis type, the hypoechoic lumen is dilated. In the contraction type, the hyperechoic lymphatic vessel walls are thick and prominent. And in the sclerosis type, the lumen disappears, and only the thickened lymphatic vessel walls are observed. While arteries are easily recognized because they pulsate, veins and lymphatic vessels are difficult to distinguish. Therefore, mastering the 5 characteristics of lymphatic vessels is crucial. These features are referred to by the acronym D-cups. D stands for Doppler. This characteristic is that lymphatic vessels are not colored in Doppler mode. Veins are colored in Doppler mode because they have scatterers, such as red blood cells, flowing through them. But lymph flowing through lymphatics does not contain large scatterers like red blood cells. Therefore, they are not colored with current ultrasound technology. C stands for crossing. It represents that lymphatic vessels do not merge with nearby veins, but pass through them. Smaller vessels join to form a large vein proximally, whereas collecting lymphatic vessels remain small throughout their course. U stands for uncollapsible. This feature is that lymphatic vessels in lymphedema are less likely to collapse than veins. In a lymphedema-affected limb, the internal lymphatic pressure is increased, making the lymphatic vessels less prone to collapse than the veins when pressed with a probe. P stands for parallel. It means that multiple lymphatic vessels may run parallel to each other without merging. It is very rare for multiple veins to run parallel for long distances without joining, but this is often found in lymphatic vessels. and S stands for superficial fascia. The characteristic is that lymphatic vessels run just beneath the superficial fascia. The superficial fascia is observed as a hyperechoic band in the central part of the fat layer. The collecting lymphatic vessels observed during lymphatic ultrasounds are located just below the superficial fascia, traveling horizontally along it. Differentiating from the veins becomes easier during lymphatic ultrasonography by operating the probe, while checking these 5 characteristics, D cups, of lymphatic vessels. Furthermore, the book delivers essential knowledge required for lymphatic ultrasound examinations, including ultrasound settings, probe comparisons, and case studies. We invite you to explore the full content of this book.